thank you both for being here. We want to do our part to promote everyone getting the flu shots. Obviously, we get about 150 flu deaths every year. Last year was, I think, relative, I understand, but 7 flu deaths last year. But in previous years, 330 some. It's easy, it's accessible.
Anywhere you go to get your COVID shot, you can get your flu shot.
I always do, and it's time for me to get my flu shot this week, and you're on my calendar again next week for a booster shot, so since I can, now that's approved. And then you both are going, I won't give you a shot, but you're going to do the same, and then maybe you could just expound on that, and then Dr. Weaver, if you would talk about some of the updates concerning COVID-19 vaccinations for going all the way down to 5-year-olds, how that's going to roll out and play out, and if it's open number. Any questions folks might have?
Perfect. Ms. Armstrong.
You don't want to talk at all before you...
You want me to talk first?
Okay,
I can talk first.
yeah, sure. Do whatever you do.
Well, I mean, I think the important thing is that this is a serious respiratory illness. Symptoms very similar to COVID. We end up with, as the governor said, up to 150 deaths on average every year. We've had years as low as 7 last year, but that's because of all the separation and the closures of things and the mitigation measures that were ongoing. And we had the highest number of Hoosiers get vaccinated last year. 51% of Hoosiers got vaccinated last year. Usually we'll run anywhere from 37 to 50%. But this disease tends to attack those same high-risk patients that we see with COVID. It is the elderly patients, it's the people with underlying health conditions, it's our very, very young children, and our pregnant patients. So I strongly encourage everyone to get their flu shot this year also. I think that we're following fewer mitigation measures now than we were last year, so I'm very worried about the numbers being up. And I really want to make sure we don't add an increased burden to our hospitals as we go forward, because we know our hospital system is already over the last 5 years. Right now our census is over. Even though our COVID census is going down, we are still well over where we've been in past years at this time. So this will help if everybody gets it.
And Hoosiers can get their flu shots in multiple locations in all 98 counties,
Yep.
including IMS.
Local health department, your primary care provider, your pharmacy. As we do IMS, we're doing flu shots out there, so a lot of our sites, our mobile sites will have a flu vaccine too. So every power any comes with a flu shot.
You've been given it to me. You hold the records. No, I do not.
All right.
Can you read what I'm thinking of right now? Is that, are you done?
I'm done. See, it wasn't that bad.
You're really-
I'm just in case.
And I'm good for another year on the flu shot.
Yes, sir, you are. Take care of it. Thank you very much.
You ready to pass?
Yeah. Except you can play a little striptease music while I take my.
You want this on? It's whatever I'm excited about. Have you ever had a problem with the flu shot?
No, I haven't.
Not everyone gets a stab for Boston Yarn.
You're a winning shot.
Oh, yeah. So if you're going on.
Check what size is that?
Yeah. Right.
Lindsay, how long's the flu shot's been around?
It was first developed in 1936.
It's a question I had earlier today. When did it start? She knew it off the top of her head, and she just read it yesterday.
And it was widely available in 1945.
Yeah, could you imagine going through that pandemic with no vaccine coming in? That would be so
Yeah,
nice.
we did it.
Thank you, ma'am. Trash can right there. You have a friend? You might left on
Do most people choose the farm they're not writing
Yeah, we advise people choose their non-dominant arm just in case it's a little bit sore, so you don't have to worry about it. If you are right-handed, put your left arm. But it's fine either way.
the issues with your. All right, thank you. You good?
Yeah.
All right, appreciate it.
with?
She did really good for an interview.
My patients always said they wanted me to do their shot. I'm like, no, you don't want a doctor to do that.
Lindsay, you want to talk a little bit about the recent developments and progress?
Yes. So we have given almost 7 million doses of COVID-19 vaccine in Indiana. Almost 3.4 million people in Indiana have been fully vaccinated. And last week, they approved for all 3 vaccines, so Johnson & Johnson, Pfizer, which had been approved a few weeks earlier, and Moderna, for people to be able to get their booster shot. And we have now given almost 300,000 booster shots in Indiana as well. So yesterday, the FDA voted to authorize vaccine for 5 to 11-year-olds. That was the first step in the process to approve vaccine for 5 to 11-year-olds, and that's the Pfizer vaccine. It's 2 doses, just like for adults, 21 days apart. Next week, on the 2nd and 3rd of November, ACIP with the CDC will meet, and if they give its approval, then the CDC will hopefully sign off on it, and we will be ready to give 5 to 11-year-olds across Indiana the COVID-19 vaccine. We expect for the vaccine to start arriving in Indiana on Monday and Tuesday, so we will be prepped and ready to start giving it as soon as the CDC gives its approval. And so we expect for that to be probably middle of next week, Wednesday or Thursday. We have over 1,300 sites that are available to give to 5 to 11-year-olds, and that's growing by every day. That includes a site in every single county across the state. As soon as it's approved, we'll update our ourshot.im.gov map so you know which locations are offering to 5 to 11-year-olds. So that includes primary care providers, pediatricians, a lot of our hospital vaccinators will give 5 to 11, local health departments, and of course the pharmacies as well. FQHCs, 100% of our FQHCs are giving to 5 to 11-year-olds. So we are definitely ready. We are excited. Our kiddos have been affected by COVID with illnesses, missing school, missing sports and activities. And so I know there's lots of parents that are ready to get their kids signed up.
The school contacts you, what happens?
So we have a link on our website for a school, for a church, for any local organization to reach out to us and ask to host a vaccine clinic. So we are ready and available. We've let the schools know we're ready to help them with vaccine clinics, and then the local health departments are ready as well. So if they are willing, then we are willing.
Perfect.
Oh, and one other thing I wanted to mention, I forgot. So, because we're so excited about 5 to 11-year-olds, and we continue to see a lot of people come out to our IMS site at the track, we're actually extending IMS through November 20th. So, starting on Tuesday of next week, we will be open from Tuesday through Saturday, Through Tuesday through Friday, we'll be open 4 p.m. to 8 p.m. so we can get those kiddos as they come out of school and people after work. And on Saturdays, we'll be open from 8 to 12. And we'll be offering the vaccine when it becomes available and is approved, of course, for the 5 to 11-year-olds. We'll have the flu vaccine as well out there. We offer Pfizer, Johnson & Johnson, Moderna. You can get your boosters, you can start your series, and you can also get tested for COVID.
You just can't start a car, right? Any questions?
You brought up the IMS stuff, and that's obviously a wonderful facility out there, but is there anything like that for the rest of the states who aren't in central Indiana? I mean, kind of, do you have
So-
anything similar?
Yeah, so we're still going to be going out with our mobile units and our strike teams across the state and offering 5 to 11 vaccines there as well. And as I mentioned, we know that we have sites across the entire state that are available and ready to start vaccinating 5 to 11-year-olds.
In terms of the availability of how many doses you're going to get for 5 to 11-year-olds, is that going to be every kid in the state can get one as soon as it's approved, or are we going to have to eventually get enough doses for that? How soon will we have those?
Right, so we do know the federal government has let us know they purchase enough doses for every 5 to 11-year-old to get vaccinated if they, if their parents want to get them vaccinated. Next week they're releasing 15 million across the country, which equated to over 200,000 for the state of Indiana. And they're, like I said, they're going to start getting delivered early next week.
And it's over 200,000 for Indiana. Is that the I don't remember what that
So
population
that's
is.
just the first range. There's about 600,000 kids in that 5 to 11-year-old range. And that's just the first bolus dose. If you remember back when we first got Pfizer, Moderna, they had that really big bolus that first week, and then it was a little bit smaller. We're expecting the exact same thing. Personally, I believe this first round will be definitely enough for everybody who's waiting and excited to go get vaccinated.
But we have no problems with being able to reorder it and get it very quickly. So if we do go through that very, very quickly, we'll be right on it, reordering more.
And Governor, you mentioned getting your booster next week. Is the booster now open to everyone? I know you're not quite at that age yet. So I just wonder, can anyone go get a booster now?
So about anybody can get it.
That's exactly how I worded it. So,
So I think a couple of things. Number one, there are definitive people that should go get their booster, right? 65 and above, you need to get it. Underlying health conditions, you need to get it. Immunosuppressed, if you haven't gotten your third dose, you need to get it. If you are an individual who got Johnson & Johnson, the studies have shown that those individuals were really available and probably by data, could have gotten their booster as quickly as 8 weeks after
which we
their
learned
first
a week
dose.
ago.
Yes, we just learned it a week ago. So if you got J&J, I would put that definitely on my list of people that should really go and get their booster dose. And then also it's individuals that through exposure, whether, they mentioned teachers and bus drivers and governors who are shaking hands and out in big groups all the time, healthcare professionals. So really, I think that anybody who really would like to have a booster should feel free to sign up and get a booster if they want.
And you feel good about the supply.
Yes, you do not feel that there's any worries with the supply.
That's what I said to kids. I don't want to cut in line, but I want to go, practice what I preach, and ready to do it whenever. So we scheduled this for the day, the booster. But could have got it today too. So probably should point out to the public that you could get if you go to the track, as you can, or you can get both.
Right.
Same day.
There's a lot of questions out there. A lot of even primary care providers are saying you shouldn't do both of them in the same day. Absolutely, you can go both your booster and your flu shot at the same time.
Is there any consideration for a mandate for the kids vaccine, or do you think it's going to be a situation where you're encouraging people the same way they get their shots before school, like the flu shot, to also get the COVID shot?
Same way. No mandate.
The doctors,
Highly encouraged. Highly encouraged.
sorry.
And by the way, can I just follow up on that? I think the information is compelling. Mitigation efforts work. And there's no better mitigation effort than being vaccinated.
Number one.
So it's true if you're 65 to 5. And so we'll continue to encourage that.
Sorry, for the doctors, our cases and numbers are trending downward again. But as Halloween's coming up, it's already getting colder. We're going to go back inside. Is there any concern that that we can see our numbers rise like we did last year?
Yes, we definitely have concerns about that. I mean, and that's why we really want to get everyone vaccinated right now, because we know, basically just a little over 3% of individuals that were hospitalized were fully vaccinated. Otherwise, since January through October of this year, everyone has been unvaccinated that was admitted with COVID. So it is really critically important that people do get vaccinated, not only to protect themselves, but to protect those little ones, like the under 5-year-olds that can. I've got a new grandbaby at home and an almost 3-year-old grandson that I want to protect them. Some people that can't be vaccinated for certain reasons, and other people that even when they're vaccinated, like the immunocompromised, still end up getting infected and getting very, very ill. The mortality rate in our immunocompromised population is very high with this disease. So yes, we have worries about that. We've seen that in other countries. As people go inside, there's less ventilation. So what we would say is, if you know the status of everybody in that room, everybody's vaccinated as part of your family, I think you should feel comfortable, take your mask off and enjoy your Thanksgiving dinner. But I think if you're in a large group of people at a party where you don't know, especially if it's not well ventilated, I'll have my mask on, just until we know our disease burden is down.
He mentioned Halloween.
Oh, Halloween is an outdoor activity, so I feel less concerned about Halloween. When kids are outside, I think they should go out and have a great time trick-or-treating.
Well, we've been a lot better though than previous years, just because, last winter we didn't, October, November, we didn't have vaccinations, so things won't be as bad maybe.
Yeah, so, even with our Delta surge, we had another surge. We saw more hospitalizations than we were comfortable with, but we did not see it to the extent that we had last fall at this time. So we truly believe that those peaks will still remain below what they were last year, and hopefully even with the Delta surge. But again, the key to this is getting more people vaccinated.
Is there that concern of sort of the flu and COVID at the same time, of someone being able to catch both?
The concern is, and even though our hospitalizations for COVID are going down, we still have right now our hospitalization census for everything in the hospitals is higher than it's been for the last 3 to 5 years. So that, plus the fact that we've lost a lot of our healthcare professionals, people that have just gotten burned out, walked away, retired, got another job, is really going to put a burden on our system. And even on good years with influenza, we do see influenza make hospitals go on diversion and other things just because they are having trouble keeping up with it. So this is the way we can help decrease that burden on hospital systems, because we know that our hospitals are full of people that have delayed a lot of their health care, and now they're getting their follow-up of their orthopedic surgery or potentially their cancer surgery or whatever.
We're still managing our way through this, obviously, and there's a lot of indicators out there that illustrate this point, but we still have the Indiana National Guard deployed in hospitals that are in permanent corrections at Camp Asbury on the border. They're being stretched thin to try to keep this thing stitched together. And so we're not out of the woods yet, but we are managing our way through it, and we know how to arrive on the other side, and that's by getting vaccinated yourself. So don't know of anything more compelling than the vaccine numbers when we look at death rates. We're still losing about 20 people a day, right? So it's here, and it'll, we got to be in it as long as it is taking lives from us. Right?
This might be a little in the weeds. This is probably for you, Dr. Weaver. Explain to me the mixing and matching now of the booster shots. I think to a lot of people it makes sense to mix and match Pfizer and Moderna, a 2-shot series. How does it work mixing and matching if you got Pfizer and then get a booster that's Johnson? How does that work?
So when the FDA reviewed the data, definitely boosters showed that increase in antibodies, right? And increased protectiveness against hospitalization, increased protection, even against symptomatic disease, right? Which is good. There's a lot of people who I just do not want COVID, right? I'm glad that it's keeping me from being hospitalized, but I also just don't want it. I think the one I want to really kind of point out is I agree with you, Pfizer, Moderna, all fine. Remember when you get your Moderna, if you get a Moderna booster, you have to make sure you let them know this is a booster because it is that smaller dose compared to the regular vaccine. But for people who got Johnson & Johnson, and like the governor, all people who got Johnson & Johnson are eligible for a booster right now. If it's been 2 months since you got it. So doesn't matter how old you are, as long as 18 plus, of course, doesn't matter if you're a healthcare worker, all of those things apply to the Pfizer and Moderna, but not Johnson & Johnson, because it showed a little bit decreased effectiveness. So some people are saying that probably should get an mRNA vaccine for your booster with the Johnson & Johnson. But again, if you get the Johnson & Johnson booster, you got Johnson & Johnson as your first, completely fine, also improves your, or decreases your, risk of hospitalization, decreases your risk of infection.
One quick question on keeping the IMS vaccine and testing open. Is any part of that, I know obviously kids are going to start getting vaccinated, so that'll put more demand on the system, but was any part of it, is there a bigger increase or demand of testing also that was part of that decision, or sort of what else played into the decision to keep that open longer?
So we definitely are doing testing out there. We're seeing our testing numbers go down. As the burden of disease in the community goes down, people are less sick, so they're less likely to go out there. I mean, I think the exception would be if we start to get a lot of flu. I mean, the flu symptoms are very similar to the COVID symptoms, so we could see our testing demands go back up. But really, the big decision why to extend it was to be prepared to help out the 5 to 11-year-olds. And we gave over 500 vaccines yesterday at the site. So we don't want to shut something down that is still successful and is serving this community. So that was the biggest decision. But while we're out there, we want to offer everything that we have to the community.
Want to talk about the hours again
Yes.
at the track? Just as an example, there's, we're looking at this statewide as well, that because of the kids in school and the hours.
Right. So Tuesday through Friday, we'll be open from 4 p.m. to 8 p.m. So we can catch kids after school activities. And then on Saturdays, we'll be open from 8 a.m. to noon.
Do you have any concern that the president might make a deeper or more of a federal mandate for the vaccine for kids at all? If that's a possibility, you could try to jump in there.
We'll just have to wait and see what the administration puts out next week. Obviously, the one decision they made on businesses may be delayed. We thought we would have more clarity on that yesterday or today. It looks like that may be delayed. I've just read reports, haven't spoken to the administration, that maybe until after the holidays. So we'll remain in constant communication and contact with the administration as they roll out the new regs.
To that point, obviously you have to see the regs,
Really do.
but is the state OSHA prepared and able to enforce that mandate?
These are some of the questions that we're asking the administration, how practically we can do this, and what load they believe that they can handle as well. Incoming calls suggesting it's happening or not happening, how it happens, when it happens, where it happens, how long they have to administer it. These are all questions that just quite frankly need answers to. And it's not to say that I agree with that mandate. I don't, but we'll look to work with them